The number of COVID-19 cases in the U.S. has exploded. We're on track to surpass 400,000 deaths from the coronavirus any day now. And the incoming Biden administration says it's only going to get worse from there. Dr. Leo Nissola is a medical expert, immunotherapy scientist, and advisor for COVID Act Now, a nonprofit that provides data on the pandemic in the U.S. And he is with us now to talk about the latest bits of information that we know. The number is disturbing. It is so far past what I ever thought we would get to when this pandemic began. I say this story sort of, every once in a while, that I remember initially when they said 100,000 people could die, possibly 200,000. I thought they were exaggerating. That was at the beginning of this pandemic last spring. I can't believe we're on the verge of 400,000 now. The incoming CDC director, doctor, says she was on Face the Nation, and she had a grim prediction for the U.S., and I want to play a little bit of what she had to say, and they get your reaction to it.
We've, as you noted, nearly 4,000 deaths a day, almost 400,000 deaths total by the middle of February. We expect 500,000 deaths in this country.
So Dr. Walensky also said that we have not seen the ramifications yet from holiday travel and gatherings. Why is this number going up so much faster, and how much worse could it get before it gets better?
Thanks for having me. Unfortunately, her predictions are likely to be true. Back in March 2020, when COVID Act Now and other COVID-19 tracking projects put up statements, and our predictions were that 460,000 Americans would likely be dead by this virus in case no actions were taken. And unfortunately, because of the pandemic response through the course of last year, we are seeing now the implications of that. I'm afraid also because of the hesitancy in some parts of the society on adopting life-saving simple measures like mask wearing and staying at home. We'll likely see more cases, especially now with the new variants.
It is remarkable, Doctor, as Anne-Marie was saying, early on in the pandemic, the reporting was that we would see perhaps 100, maybe 200,000. And it wasn't just from the reporting. The President of the United States, in an interview, said if we see 100 to 200,000 deaths, he believed that we are doing a good job, that he's doing a good job. Well, as you know, that's not the case. And Dr. Fauci said this weekend that the Johnson & Johnson and AstraZeneca vaccines are weeks away from getting emergency use authorizations from the FDA. The Johnson & Johnson vaccine is different than many of the others. It only requires one dose. Could that be what we need to ensure enough people get vaccinated?
First, just let me say, one life is too many. 100 lives are too many. 100,000, it's unthinkable. So I agree with you. It's absurd that we find ourselves in the place that we are right now. I think we need all the help that we can get. So AstraZeneca's data will likely to be available for us to analyze the clinical raw data, J&J's data as well. The first early reporting looked great. I'm excited to see the raw clinical data. I understand the safety board and their report to see if it warrants a emergency use authorization. But again, this is all good news. We need every single help that we can get in the fight against this virus.
A new CBS News poll finds that a majority of Americans think that the COVID-19 vaccine rollout is going too slowly. So President-elect Biden's chief of staff said that this weekend the administration plans to give out 100 million shots in the first 100 days. Sounds pretty ambitious, but they say they believe they can do it. If they can, is that enough to make a dent in the spread of the virus?
Right. It's pretty ambitious, and that's what we've been calling out for. I'm very excited to see the team that they put together. Those folks are experts, and I do agree on their plan. I've seen the rollout. I think it's doable, it's possible, but it will require that the federal administration set up clear guidelines as to who we should prioritize and clear guidance to the states on how this strategy at the granular level should work. Because what we are seeing today is it's a failure on that communication. from the Trump administration to the states, and that's how the response, in my opinion, has been so botched. You see, some states are still unaware of how to deliver those drugs, and so I do think that their plan looks great. It is doable, but it will require a tremendous amount of effort in coordinating with counties, cities, and local health officials.
10 people who got the Moderna vaccine at a clinic in California had allergic reactions in 24 hours. Now, there are some health officials that are recommending the state temporarily stop distributing that batch of vaccine. We don't know what caused these reactions, doctor, but what could be at play here? I get that it's only 10. Is that enough of a number, of a sample, for you to be concerned?
So first, adverse reactions, they occur in every single drug that is approved and even over-the-counter drugs. What we do need to know is what happened there. This Moderna vaccine was approved under the emergency use authorization. And the data that they have shown the agency stated that those allergic reactions were likely to occur 1 every 100,000 doses or people. So for me, I think I could agree with California's health authority on halting the delivery of just that batch and understanding what happened there, if it's just a happenstance or there was something off with that lot. And I think that's important to address even further the need for vaccine cards, the need for vaccine passports. And setting up those data points for us to be aware who got those batches and then analyze and backtrack to see if there's anything there or not.
All right. Dr. Leo Nissola, thank you very much, doctor, as always. We appreciate it.
Thanks for having me.